Hey there, Coach Devin here. Let's talk about something uncomfortable. Healthcare. So, in Canada, we have nationalized healthcare. So, as all of you know out there, basically what that means is we pay more taxes. And when we pay more taxes, the government then takes that money and puts it into healthcare. Now, there's always issues with healthcare, obviously, because lots of people don't want to pay a lot of tax. People don't like taxes, understandably, because people want to take home more money. However, we all like going to the hospital and not paying $10,000. So that's where we are in Canada. We have nationalized health care and we pay for it through our tax dollars. Seems pretty fair. Seems reasonable. What the United States of America has is a slightly different system. They pay much fewer taxes, way less. In some cases, not even, income tax is hardly even a thing in some places in the U.S. So that's what they like. However, when you go to the hospital visits are not free. They cost a lot of money. You got to pay for them. And that's okay. Here's where the issues fall in. Now, the U.S. is maybe not a very healthy society. Let's break it right down. They're an unhealthy society. There is the obesity level and the weight gain in the United States through the food they're eating, and the lack of exercise is astounding. It's bad. Very, very bad. They have a epidemic happening. There's a pandemic happening right now with COVID, but there is an epidemic of weight gain in the United States. It's just the way it is. There's a lot of weight gain. There's a lot of very unhealthy, overweight people in the United States. That's the way things are right now. The reason is because of the food they're eating and the lack of exercise. It's just the way it works. If you eat shitty food and you don't exercise, guess what will happen to you? You will gain weight. You will not be healthy. Because of that, you will have health issues, which means you will need to go to the hospital. Now, the United States has basically said this. Your health, that's on you. We're not going to charge you very much taxes because you don't want to pay taxes. However, if you get sick, you have to pay for it yourself. And people in the United States said, okay, sounds good. In Canada, we have a slightly different situation. So in Canada, we have, unfortunately, a lot of the same thought processes when it comes to food as the United States has. We are doing the same kind of things. We're eating at McDonald's. We're eating too much carbohydrates. We're eating too much fat. We're eating too much food. We're drinking too much sugar. We're eating too much sugar. We have bad habits. What we have in Canada is now an Americanized thought process to food. We just do. We're eating like Americans. Now listen, if that's your thing, then that's your thing. However, our problem is that we pay tax dollars for our healthcare. So let me explain. A little simple thing, and I'm just going to give you an example here. If you're a smoker, obviously smoking, not good for you. And when you buy cigarettes, you pay a ton of money in taxes. The reason you pay that ton of money in taxes is because of the fact that we know down the road, the government knows you're going to cost a lot of money. You're going to get cancer. You're going to get emphysema. You're going to get asthma. All kinds of bad things are going to happen to you. You're probably getting hooked up to a ventilator. That's just the way this goes. That's what happens when you smoke. You make a decision to do an unhealthy, very unhealthy habit, and you pay the price later. However, you do pay for it. And you pay for it throughout incrementally because cigarettes and cigars and pipes and shit, they are taxed to death. And there's a reason for that, is because the government knows you are going to be a drain on the healthcare system. That's the way it is. Now, it makes sense, right? You understand, why should you and I, if we don't smoke, why should we have to pay for a smoker who's made horrible life decisions, right? That person should pay for it. And you know what? By most objective thought processes, that person has. If you smoke a pack of cigarettes every day, you're putting a lot of money into the government coffers. And you do that, and down the road, that money's pulled back out to take care of you when you're sick and dying in the hospital. To me, that's a fair choice. If you want to smoke, that's your right to smoke. It's okay. And when you do smoke, you're going to pay for the fact that you're super unhealthy later on down the road. That's just how it works. Same thing happens with alcohol in Canada. In the United States, alcohol is super, super cheap. In Canada, ton of taxes on alcohol. Why is that? It's a bad habit. I'm not saying all alcohol is bad, but I'm saying that people, if they drink to excess, you drink a lot of liquor, you're going to have health problems. When you have those health problems, guess what? You've paid for your health care because you've hurt yourself, but you've already paid for it, so it doesn't hurt everybody else. The problem when it comes to food, and Americanized food in general, is that we're not paying enough. And that might sound like an unpopular thing to say, but it's true. We are not paying enough taxes on food for the fact that we're going to get really sick based on our bad habits. We're eating McDonald's. We're eating, Harvey's, Wendy's, whatever else. You're eating Big Macs. You're eating, chicken wings at the grocery store. You're buying chips. You're buying pop, and you're doing it day in, day out. One day of eating some junk food, not going to hurt you. In fact, you could have a day a week of eating junk food. Probably going to be fine. Everything in life is about moderation. But if you eat a lot of garbage all the time, you will have serious health problems. Those serious health problems, though, are an enormous drain. Just a huge drain on our healthcare system. So we have a problem in Canada because of the fact that we are not charging the people who are accessing our healthcare system because of their bad choices when it comes to food. We do it with alcohol, we do it with cigarettes, but we don't do it with food. That's a problem. And it is a problem that will continue to get worse because the United States has an epidemic of overweight, obese people who have serious, serious health problems. It's just a fact. Guess what? Canada has it too. It's getting worse. When I was a kid and you went to the beach, there weren't overweight people at the beach. It just really didn't happen. Like, if there was one person there that was overweight, it was like, oh, look at that person, they're overweight. You noticed it. Nowadays, you go to the beach, it's weird to see somebody who's not overweight. When you see somebody who's fit or skinny, people stare. Why do they stare? Well, the reason they stare is because that person sticks out like a sore thumb. That person used to be the norm. That person is not the norm anymore. Because our bodies are changing. People are getting more and more and more unfit. You go back to the 1980s and 70s and 60s, people were nowhere near the size they are now. Weight-wise. They just weren't. But guess what? Now they're bigger. People are getting consistently bigger. The size of people, bigger and bigger and bigger. And bigger means more unfit, which means more unhealthy, which means more healthcare dollars. But we're not charging for it. So where we have a problem in Canada is that we have an Americanized thought process to food, but not having the American thought process to healthcare. Now, I'm not saying the U.S. has healthcare figured out. Listen, I'll be honest with you. I like going to the grocery store. Not my bad. I like going to the hospital and not having to pay for it. I don't want to have to go broke because I'm going to the hospital. I think we all pretty much agree that. We don't want people dying because they can't afford to go to the hospital. I get all that. I'm on board with it. However, if you're like me and I try to take care of myself as much as possible and you have a freak sickness like I had with staph infection, you go to the hospital and it doesn't cost you $20,000 or $40,000. Just doesn't. So I am thankful for that. But also, I am not in overall, now given in the last couple months I have been, but overall I'm not a huge drag on healthcare because it doesn't cost me very much money. Because I take care of myself. And the more you take care of yourself, the less you cost that healthcare. Every year that goes by, if you're fit and you take care of yourself, it costs less money. We have a problem. We have an Americanized way of thinking when it comes to food. And we have a Canadian socialist, to an extent, way of thinking when it comes to healthcare. Those two things can't mesh. It can't work. So what do you do about that? How do you fix that? Do you punish people because they eat bad? Well, you could do that. You could charge more money for junk food. Say McDonald's costs $75 now to have a meal for 4 people. $100, tax the hell out of it. You could do that because that's like basically a bad choice tax. Call it a bad choice tax. You're going to have bad choices with your food, you got a big tax. You could do that. Or maybe a better way would be to have a carrot. Make some incentives. Bring out some incentives. If you go to a gym, you get tax write-offs. You get an incentive to go to the gym. You get an incentive in general to be healthy. If your waist to hip ratio is good or it's going down, there's an incentive for that. If there's tax incentives, if there are incentives across the board for your job, all kinds of things, to have that, that is the best way to do it. Giving people an incentive to be healthy is better than beating them down with a stick because they aren't healthy. Look, alcohol, cigarettes, people, they don't mind the stick on those. But when it comes to physical fitness, it's a different ballgame. Give people the opportunity to be more healthy. Give them a carrot and say, hey, a carrot doesn't just make you healthy, it also is going to help you monetarily. We're going to help you monetarily because you're putting out money to be more healthy. Help with gym memberships. Make it a tax write-off. Do things to help your country and your population be more healthy, and we will all save money. It's a win-win across the board. If more of the population is healthy, guess what happens? That means you save money on health dollars. It's just a fact. This is not rocket science, and what I don't understand is we have a very reactionary thought process when it comes to medicine. Let's get you better when you're sick. How about let's keep you healthy and fit in the first place? Let's keep you from getting sick. It is cheaper to keep you from getting sick than it is to take care of you once you do get sick. Those are facts. When I went to the hospital with a staph infection, I went 3 different times. The first time they could have looked and seen that I had the staph infection. Nobody got back to me. Well, guess what happens with that? I get sicker. Then I end up in the hospital. That costs more money. Had someone got a hold of me the first or second time I went to the hospital and said, hey, Devin, you got a staph infection in your back. You got to come in. We're going to give you antibiotics. And you're going to go home. That would have cost way less money. You're talking about planning ahead. And that can be hard because people don't like to plan ahead. Politicians especially are trying to win another election. That's all they're thinking about, win another election cycle. But you know what? All this needs is a change of thinking. Let's plan ahead. Let's think, how can we be more fit? How can we take care of our population better? And by taking care of our population better, how can we pay a little money up front, give them some incentives up front, and those incentives, in turn, will be good on the back end because it will save us taxpayer dollars. Listen, I own a gym. I own 2 gyms. So when I own gyms, if I can figure this out, people in politics should be able to figure this out, right? Stephen McNeil should know this. Trudeau should know this. This isn't rocket science. It does take a different thought process. It's going to be harder to sell. But you know what? If you keep a healthier, happier population, you will get better results down the road. It's just the way it is. Think about it. If you have comments, questions, things you want me to talk about, pitch them up. I'd love to hear from you. Have yourself an amazing day. Stay fit. Don't fight the awesome. And happy Canada Day.